Hi, Minister Dix and Dr. Gustafson. My question today is about testing. We're seeing traffic gridlock around testing sites like the St. Vincent site in Vancouver, and people who need tests being turned away from the city centre in downtown Vancouver. Why are people being turned away if there's a capacity for 8,000 tests a day in BC? And how do you plan to ensure that health authorities throughout the province have the resources they need to meet the demand for tests if numbers surge as we move into cold and flu season in the fall?
Thank you. That's a really important question. And yes, we have been working on testing capacity in two ways. One is the testing capacity in the laboratory. So that's when the specimen has arrived to the laboratory. And that's a really important place to work on testing capacity. And we've been putting a lot of effort into that testing capacity. And health authorities are, at the moment, looking at their demand for testing and ensuring that the availability of testing is increased in every region, in every health authority, so that the first step in the test, which means that a person who requires a test, is also available to them as rapidly as possible. We have had a rapid increase in the demand for testing over the last few weeks or last week or so, and we are seeing some delay in the ramp up of that capacity. But I can assure you that all health authorities are working very hard to make sure that that capacity is there and that people can receive the test when they need it.
Follow-up, Denise?
Yes. You mentioned that you're working on testing capacity in two ways, in the laboratory and saying that people who need tests are getting them. Is the delay then in the site testing, when you say there's a capacity for 8,000 to be tested daily in BC, does that mean there's a laboratory capacity but not necessarily a site capacity?
No, I think over the weekend, I believe over the 3 days, and I can confirm this for you, the health authorities did about 10,500 tests over the weekend. That's the basis on which the 236 test case positive cases came, which is, as you know, significantly more than we had been doing. So part of this is measuring public demand and ensuring that our facilities are able to meet it. There's no point in having facilities ready to take 5,000 tests if there are 2,000 people coming. We've seen an increase. If you look at the numbers over time, and you can see all this on the BCCDC dashboard, right? Yes. You can see what's happened, which is we've gone from in the neighborhood of 1,500 to 2,000 tests a day to, I think, Thursday to Friday it was 3,500 tests, and over the weekend it was about 3,500 a day. And so that number has increased because there's been more concern and more demand in the last number of weeks, and we're able to respond to meet that, and we will.